And good morning, everybody. How's everything going out there? Giving you a 360. Look at my truck. See that windshield? Still iced over. Even got ice down here on my chair here. Here's Arizona snowballs. Very small. Oh, everything is damp and icy, so I sit on the stoop and try to get this thing settled so I can look at you, talk, and smoke at the same time. So, here's another day. No dollar. I don't do that anymore. I just make 12 grand a year. They need to give us a 10% or better raise next year. I'm telling you that the past two cost of living increases that the Social Security did not give us due to our former regime in the Oval Office. Don't get me started on that. But today's video, if I can keep this thing from moving around too much. Today's video, when I get inside, I'm going to be discussing my conditions and how my clinical trials are working on my conditions. Okay, because that's the whole thing about clinical trials, is what is the medicine doing? Or what is the drug doing as far as Big Pharma? And it's all bullcrap. Prohibition is just bullshit. And prohibition creates criminal empires. Okay. Outlawed booze. What happened? The Kennedys, the Rothschilds, and a bunch of other families got rich off illegal booze. Then they banned hemp. After growing it for World War II, they knew it was necessary and they knew it was useful. They grew it. But after World War II, they banned the growing of hemp again. It's so wrong. There's so many industrial things that can be done with hemp. That's going to be one of my videos. Okay, this one is my continued clinical trials on my diseases, what my diseases are, how cannabis affects it with my morphine and everything else I take. And I'll talk a little bit about getting a pain agreement with your doctor. Okay, like when you go to a new doctor, you want to ask him for a pain agreement. Usually they'll come up with it themselves. If you're asking for opiates, they put you on this pain agreement where you agree and sign a contract between you and your doctor that you will only take your prescribed medicine. Like me, I promised I won't drink alcohol, I won't do coke, meth, ecstasy, I won't do anything but take my opiates. And that gave me the privilege of the medical marijuana card. Put this out and I'll go save it for later. I don't just smoke lots of cigarettes, I just smoke a little bit because I have to go inside. And let's go inside and talk. What are we going to talk about? Well, let's start with my diseases and how cannabis affects them. Okay? What does cannabis do that makes it so great? And it makes it so great that it is becoming the medicine of choice for people all over the country and the world. Okay? I've got friends overseas that they do their own growing. I don't know if they're legal or not. I won't mention any names. My clinical trials. Fibromyalgia cannot be cured. It's characterized by widespread musculoskeletal pain. I get tactile allodynia, the tender skin hurts That's why I can only use a certain venom and China gel on my skin, because things like methyl salicylate, the ingredient, the really menthol ingredient in a lot of topical anesthetics, and it literally burns my skin. Okay? Cannabis helps stop that. It helps my skin be better at, normally I'd scratch myself and I'd hurt. Right after I scratch, wherever I scratched, it hurts. Because it feel like I'm literally scraping off skin. Okay, when I shave. Especially when I'm shaving my skull. Right there, you can see. This is a really hard spot to get when I'm going up with the razor. It cuts me right there. But that's another thing. But my body, right now, I go from 4 to 10. 4 is great. I have never been that low in years. Years. Literally. I have not been down to a 4. Only if I took a morphine before sleep, and while I'm sleeping, my pain level would be lower. But I wake up between a 7 and a 10 every day of my life. Due to fibromyalgia, my degenerative disc disease, okay. Yeah, I got a 4th morphine, immediate release from my doctor. After 3 years, okay. And after he did the blood test that proved that my liver is functioning well. My liver is tolerating the morphine. Why? What I found out, marijuana is the preferred adjunct to opiate therapy. So that brings me to my clinical trials, pain agreement. If you're not getting satisfaction from a doctor, and if you think that you can get opiates for your pain, and you think you need them, like me, I really do need them. If I skip a dose, I know it. My pain levels go, but I don't feel withdrawal from morphine. Why? Marijuana. Marijuana attenuates the symptoms of addiction. So that's why morphine and marijuana go together. But they don't belong together on the schedule of narcotics. That's where it's wrong. But anyway, a pain agreement is, like I said, I entered into a contract with my doctor that he would prescribe me opiates. And this was years ago, before the miracle marijuana. Even before he put me on OxyContin, I was taking up to 120 milligrams of hydrocodone a day. And that had Tylenol in it. The hydrocodone has got Tylenol, acetaminophen added. That's not good for your liver. I didn't have very good liver numbers then. But when I got off the OxyContin and went on to morphine and weed at the same time, it's just the best thing ever. And that's part of my pain agreement. My doctor scripted me marijuana. That's why I don't abuse it. That's why I keep my groups clean. I do not allow people to come into my groups and sell anything that gets you high. CBD from Tracy's CBD Hemp Save Me Facebook page, hempsavedme.com. I always give her a shout out. I even gave her a double thumbs up because her company sent me an email and said rate us. So I gave them the smiley face, and I told them that what I do. I'm a legal weed smoker. I take opiates, but I also have been using the hemp oil, and it turned my wife around, her friend with cancer around, and it's helped me. The hemp oil has helped me have a better life. Now, on the hemp oil, some doctors don't realize, especially probably the older ones, that they get set in their ways. I had one doctor like that. It's like every time he'd ask me a question, I'd start to answer. I'd only be halfway through the answer and he'd go, shh. And he's writing in his book. I'm like, if you ask me for a question, don't cut me off halfway through the answer. Let me put out the entire answer. Well, fortunately, that doctor didn't like my attitude. Well, it's good because I didn't like his attitude. He didn't listen to me. Okay? I switched over to another doctor in the same office, and that's the doctor I've been with now for 6 years almost. And I've had a pain agreement with him since then that I won't drink, I won't do any other things than what I am prescribed. That's a pain agreement. So, if you go to a new doctor and you need pain medication, tell them, look doc, I really, really, really need opiates. Please, give me a chance. Give me a pain agreement, and I will agree to live up to that. And most states have a pain agreement for that particular state that the doctor pulls up, prints out, and the two of you sign it. Okay? And that pain agreement is what will help you get the pills you need. All you gotta make sure is that you do not break the rules. Now, Tracy's products, the CBD. She also has the capsaicin patches, the hemp salve, and the things that Debbie's taking. It's chaga mushroom, reishi mushrooms, and something else in a blend. Hold on a second. And I'm back. Yes, here it is. Here's the stuff Debbie takes. 30 capsules, CBD powder capsules, antioxidants, immune support, high bioavailability. It's got each pill is 10 milligrams of CBD, 180 milligrams of chaga mushroom, 20 milligrams of 72 trace minerals right there at the bottom. And the mushrooms are chaga mushrooms and reishi mushrooms. I saw that someplace else. They don't have it here. But it's vegetable oil caps. And it's full bioavailable full spectrum CBD powder. These are what turned Debbie around. Now, they contain the chaga mushroom. Okay. Mushrooms, the psilocybin mushrooms, psychedelic. Okay. There's rishis and the chagas. They could have effects on your medications that you're taking. CBD alone, if you just take the CBD from Tracy, that's fine. But you still want to tell your doctor, and you want to approach them carefully and say, Doc, do you know anything about cannabidiol, hemp-derived CBD? If you get a nice positive comment, yeah, and he says yes, tell him that you would like to start trying to take the CBD capsules along with your painkiller therapy. I don't see a doctor denying you that. Now, if you're taking something that the mushroom blend doesn't go with, okay, you want to watch out for that. Ouch, sorry. And you gotta, you have to explain that hemp oil is legal in all 50 states. Okay? So when you're using hemp as an adjunct to your bedside pharmacy, like I do, okay, I'm taking the 900 ml, the orange oil drops. It makes me feel much better. I feel better every day. I'm probably never gonna see pain level down to 1 or 2. Never. Basically everything I've got is terminal. Not meaning I'm going to die right away. But it does mean that I am going to die with these conditions. They're here for life. Let me see. Pain agreements and talking about hemp oil. Okay. If the doctor doesn't like weed, if he's really dead set against it, give him my YouTube address. Tell him to watch my videos. And I'll tell you, doctors, hemp oil is safe. People that take the mushroom blend should double check and see if the mushrooms have a side effect with medication you're taking. But CBD from hemp by itself is the safest thing ever. There is no toxicity level to CBD. No toxicity at all. You could lay in a bathtub full of it and drink mouthfuls and mouthfuls of CBD oil, and it will never hurt you unless you drink it too much and you get a full stomach. You get that. If you ever drink a really big glass of water and on a hot day and it feels like a lead sitting in your stomach, that's about it. CBD goes to the CB receptors that we have in our bodies from the ECS, endogenous cannabinoid system, and it puts the cannabinoids to work fixing the body. Even if you don't know what's wrong with the body, okay, doctors, if you're showing this to your doctor, doc, listen, go back a couple videos. I talk about my wife, her friend back east with ovarian cancer, added hemp oil to her chemo. Amazed her doctors. That my wife herself went through 18 months of worse and worse and worse feeling. 4 days of taking those pills, and she's fine. Doctors have to, what you do is you tell your doctor, you say, look, all doctors are like 15 to 20 minutes and you're out. Okay, you may sit there and wait an hour, but they've only got a limited amount of time they can spend with their patients daily. And so, like my doctor, sometimes we only have to be there 5 minutes. I get my refill scripts. I have to have my morphine scripts in printed form to take in. All my other medications, the doctor can I just call Walgreens and they tell the doctor, and the doctor says, yes, you can have the script refilled. And that worked good that way, okay? And I work with my doctor. I've even told him I started on the hemp oil, and he knows because we've learned together. I've told him that I won't do things like kratom, salvia, things like that. Those will count against you in the end. You don't want to tell your doctor you're taking things like kratom and salvia. They're not very safe. A lot of people say, yeah, they make their dandelion stuff and their kratom and their salvia, and they say they make it safe, but the effects do not last. I think salvia is like you can relax and unwind for like 20 minutes. That's it. It's gone. It's gone after that. Okay. Medical marijuana doesn't. It gets into your system and it works immediately. Sorry, I had to medicate. But if you need to go to a new doctor, you want to enter into a pain agreement. Bring it up first and say, Doc, I really like a pain agreement with you because I really think opiates might help me. Try some oxycodone or some hydrocodone first. Some people can take OxyContin and have no constipation and negative side effects. I couldn't. OxyContin ruined my insides. Okay. Morphine has fixed it with cannabis. And these are the facts that I'm trying to put across to everybody. Is that opiates therapy is better when it's used with marijuana. Scientifically proven facts. Okay? So when you're doing your pain agreement with the doctor, try to get the doctor, if you're in an illegal state but hoping to get legislature, get the doctor to put in the pain agreement that when the state becomes legalized, that you would like to utilize medical cannabis. Okay? The psychoactive THC side of the hemp cannabis sisters. Okay? Because hemp's non-psychoactive, non-addicting, hypoallergenic. THC, some people are tender to this THC. All they have to do is drop the THC side. Go to hemp only first, even. Or just try lower THC, high sativas. They have a higher CBD count, so you get less buzz. But THC is still a very, very, very good thing for your brain. It is. It's the best. Okay? Like I said, I lost 2015. I've regained most of my memory back from that. I've increased my IQ level through smoking weed. Okay, and you can't deny the scientific proof that, like me, I'm doing my clinical trials. Yes, my clinical trials involve smoking weed. There's nothing in there. But it's okay, because I'm legal. I'm a legally scripted medical marijuana card holder in Arizona. There's a disclaimer right there. And I am not trying to diagnose, treat, cure any diseases. All I'm doing is passing on the information that I've learned off the internet that shows that cannabis is a medicine. And it is probably the single best plant Mother Nature or God or whoever created. This plant that has so many different flavors, so many different colors, aromas, effects. Okay? Different terpenes, even. Just the different things that smell have different effects on your body. Kind of hard to believe, huh? Well, why do they tell you to take things like, what do you call it? Rosemary. They say use rosemary in your cooking for this part of your healthcare. Why? Because of the terpenes that are in it. Okay? It's not the rosemary itself. It's that terpene, it's the aroma, the strong smell that you get from it. That's actually what the viable action does to your body. get back to my notes here. I'm skipping all around. But I'm doing clinical trials myself, on me, and I'm sharing it with the world. Everybody who subscribes to my channel or follows this channel, share my videos, okay? I'll keep them all under an hour, or just add an hour. But I have so many things wrong with me. I mean, my pain alone can be chronic, severe, sharp, diffuse, spasms, anxiety, fatigue, depression, migraines, joint stiffness, irritability, tingling feet, dysmenorrhea for ladies. And there's no operation that'll fix fibromyalgia because it's your nervous system misfiring, okay? You're getting mixed signals across the synapses between neurons, between the neurotransmitters. And that's where marijuana comes in great, because it's an all-around curative. That's better. But I was saying, all my diseases are terminal, so I'm doing these clinical trials to prove to people that we don't need clinical trials. I'm doing them, and I'm telling you exactly how it works, okay? I get a better quality of life and pain relief from cannabis and hemp oil. There's a Dr. Ethan Russell. He thinks that fibro is possibly due to clinical endocannabinoid deficiency. Now, just with my fibro, I'm constantly assaulted by my immune and nervous system, and the only thing that gives me immediate relief, more than my immediate relief morphine, is marijuana, because it's instantaneous. Okay, even if I have drops under the tongue, or my vape, you get very little vapor out of this, but 96% of THC stays in your lungs. When you exhale, there's only about 2 to 4% THC, and it dissipates. So secondhand smoke is not there with vapes. In fact, cigarette vaping puts out more toxins in the smoke than these do. Okay, my discs. My discs are thinning, hardening, softening, extruding, which means, the vertebrae are sitting just apart like this, and there's, you got a little gasket right there called, your disc. And it extrudes if it gets compressed, and it oozes out of the side of the vertebrae and presses against the spinal cord. Let me tell you, that's bad. Yesterday I re-injured myself. I fell down on the ice outside on the deck because my shoes were too slick, and I tried to catch myself with the chair, ended up popping this shoulder out of joint again, landed on my butt, twisted my knee. So that's why I took yesterday off. But every part of the human body has cannabinoid receptors. This has got to be, I don't know how many times I can reiterate it over and over and over and over again, that we have the system in our bodies. We need to utilize it. Utilization requires legalization. Okay? And people out there need to learn to educate, to medicate, or just learn the facts and get off your high horses So, you don't like weed. Okay. We don't like you for not liking weed. So piss off, bro. You cannot like weed. Don't smoke it. Okay? But when you get ill, and when it's something marijuana could have fixed, think back on it as if you're on your deathbed. How many more years could I have lived if I had just stopped thinking the wrong shit, just being swayed by the propaganda and bullcrap? Okay, you can extend your life 10 to 20,000 years ago. The average lifespan of humans was 50 to 60 years old. And just 10,000 years before that, the average lifespan of people were dying of old age at 38. Broken down, gray-haired, everything. The longer we've lived, the more we adapt to our environment, the longer our lifespans have become. Cannabis has been found to improve the lifespans. India and China, right there. Just imagine the billions of people. Okay, there's almost 4 or 5 billion people in just China and in India alone. And they've lived longer lives than anybody else. And that's because they utilized cannabis. Think, learn, Google stuff, okay? Don't just take my word for it. But I do still say, trust me when I say that cannabis helps everything, okay? It's helping me through the worst things that could ever go wrong with the body, okay? Fibromyalgia, all over 200 plus symptoms of all over your body. Just that alone, okay? And chronic pain syndrome itself is they consider it a psychological and physiologic disability. The persistent pain is what creates the psychological part, and what they're saying is that it's psychologic and physiologic, because of the physiological difficulties with your body, it affects your mind. Okay? Some people get their pain and they get PTSD from the pain that they go through, because it's a traumatic experience. Let me tell you, I've been in 10/10 pain. Okay, where I really wish I would really have loved to go to the hospital and said, just put me in a coma. That bad. But if you're gonna go to your doctor and ask for opiates, don't put on your makeup. Don't make yourself look all pretty. Okay, because if you can't go to your doctor's office and say, I'm in 9/10 pain, and you've got your eyeliner perfect. Okay, he's gonna look at you and say, you gotta be kidding me. You can't be in that kind of pain. Okay, my doctor looked in my eyes and saw my pain. And I sat there in his office. They brought me 3 blankets to cover over. I was shivering to death. And the office was warm. Everybody else was fine. As I was coming off the Oxycontin still. And it made my body temperature just go haywire. But let's get on things here. Chronic pain, chronic fatigue, chronic spondylosis, spinal cord stenosis. I think I've told you this all before, where the nerves come out of the vertebrae. up and down your spine. They're getting closed over with bone growths. Okay. Cannabis helps bones heal. So I'm pretty sure it doesn't take bone growths away. I've yet to find something definitive on that. I've looked around. But as far as reversing any of these things, it would take operation after operation after operation just to fix my body. And in the end, it won't really be fixed. It won't. I'll still be carrying the fibro around. My discs will still be degenerated and degenerating. Okay, they can throw all the synthetic things in there that they want, but what it's gonna end up do is it's gonna leave me with zero quality of life and having to have a full-time caretaker, which we can't afford. So yeah, I have to take my opiates and I have to smoke my weed. And to deny everybody else the right to access marijuana and self-medicate. Okay, instead of making people pay for the Affordable Care Act and finding them money that they couldn't afford in the first place for not signing up with the act, okay, and all this flack going back and forth about that, let your patients smoke. Okay? Don't monopolize. Don't believe Big Pharma and don't believe DEA when they say that this has no medicinal value. It's had medicinal value proven by the government as far back as 1975. Okay? That's why they have government patent 6603507 or 30507. 660-30507. Something that I used to have the patent number memorized. But hemp is hypoallergenic, non-addicting, non-psychoactive. Yes, marijuana has psychoactivity. It's not really a negative side effect. Okay, because it's doing things that people don't seem to understand. Yes, you smoke and a person gets high and giggly, fine. You don't know what's going on up in here, really. It's doing more than making you giggly, okay? It's improving the health of your brain through the THC receptors that are in your brain, okay? In the DNA. You have CB1 and THC receptors here, CB1 and 2 receptors everywhere else. That's a direct indication that we need cannabinoids. We need CBs to go on these receptors. And when it gets there, okay, this is not something like, like if you get too much penicillin at once, you will get sick. It's not the same with the weed. And just, what can I say? I got lost. Hold on. I'll find where I was. Okay, I'm back. I found out where I was supposed to be going. I lost my page marker. But I wanted to go, why clinical trials? Okay. Medical marijuana has been found to reduce chronic pain. That's why my doctor, all he put was chronic and severe pain for my medical marijuana card, because that's all he needs to put, because that's what's one of the qualifying conditions in Arizona. Patients with epilepsy, chronic seizures, there's an FDA-approved Epidiolex, which is a 99% CBD extract, and it's for kids with epilepsy. And that's just like the hemp oil that I say you can take a little bit and rub on their tongue in the middle of a seizure. So they've actually got an FDA approved stuff out there for this. Probably cost a couple $1,000s a bottle. No insurance. Marijuana has been found to ease nausea and vomiting, especially going through chemo and radiation. It increases the appetite, enhances the flavor of food, which is what makes people eat. And it is excellent for wasting disorders, HIV. CBD itself is a sleep aid. It reduces anxiety and depression. Marijuana has been shown to protect the liver in binge drinkers. That's called binge alcohol-induced steatosis. And binge drinking in itself is not good. When I was last time I was in the service, there was this one guy in the unit that his breath smelled like death. And he always kept to himself and he's very quiet. And so when I got there, I asked about him and they said, oh, he's a drinker. And he has antabuse. He has to go to the captain's office every morning and take his antabuse in front of the captain. Because he was drinking. Just drinking. Close to killing himself. Okay? Marijuana will help this alcohol-induced steatosis. CBD is proven to stop the growth of cancer cells in lung, prostate, and breast cancer. Proven. Why do we need clinical trials? Dun, 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 dun. There are CBD lotions and salves that successfully treat hives and allergy-induced rashes. Those binge drinkers, weed also helps you and get through your hangover. And let's see, stiffness side effects. Inflammatory bowel disease. I think I talked about that. I talked about eating it. Okay. Everything I'm saying here, I'm just reiterating. I'm going over and over. I'm just jumping from page to page in my book. But what it all comes down to is prohibition against the people. Because you gotta look at it this way. You can't deny that prohibition created criminal empires. Alcohol. NASCAR came from alcohol runners. Okay? Guys would soup up their cars so that they could get away from the cops back then. Okay? And there was liquor coming over the border, across the St. Lawrence River, from Canada into New York for decades. Why? Because we banned alcohol here. Okay? And they came up with non-alcoholic beer, which nobody bought. Okay? Because it sucked. And it doesn't give the people what they want. Marijuana isn't so much giving people what they want, but it's giving them something that they need. As far as I'm concerned, with the ECS and the CB receptors, getting back on track, is an indication that we need the cannabinoids in our diets. And if there's no toxicity level, that means that you just flush out whatever you don't use. But every cannabinoid receptor in your body does nothing but good things, positive things, no negatives. Okay. Yes, you can look at dry eyes, dry mouth, and cotton mouth and stuff like that. Those are minor minor side effects. That's it. Those are the negatives. And maybe having a big pizza delivery bill. You know, think about it. But it gets down to prohibition, and it just creates criminals, cartels. Okay? The cartels first started just smuggling pot over. Okay? Later on, when the drug war started and we started to interdict some of the weed business, there became a demand here for cocaine. Vietnam brought out a demand for heroin. All of these things can be easily fixed with cannabis. So, doctors, listen to your patient, okay? Try to be empathic, try to see what if it's really wrong, okay? If a person's really in pain, you'll be able to see it, okay? And my doctor has probably seen a lot of people in pain, so he really believed it when he saw me. I guess, I don't even know what look was in my eyes, but Debbie said I just looked like death, you know, run over and on the side of the road. But I have to get smoking here. I'm in a lot of pain all of a sudden. Pain agreements. Docs, patients, make agreements. Get medical marijuana somehow. Because that's what it is, it's medical. Okay, some states are still claiming it's a drug. It's not. It's medical. I said yesterday, Arizona Medical Marijuana Program. If it's in the title to the Department of Health and Human Services, then that tells me it has medicinal value. And that should tell us all that we need legalization. That's been the key. It's a Schedule I narcotic as having no medicinal value, but there's all this evidence to the contrary. Especially that are not addicting, okay? It's nowhere near, 9% possibly is nowhere near any kind of significant number when you look at the alcohol and tobacco, other drugs. It's wrong to prohibit the people. This is like saying we can't buy aspirin when we have a headache. This is like saying we have to get a script for everything. Okay? We shouldn't have to. Okay? This right here is an antidepressant, anti-anxiety, blood pressure regulating, mind soothing, sleep inducing medicine. That's what weed is. And turning out to be a bad morning, sorry. I'm actually starting to feel like I did yesterday morning, but I'm almost done. We're at 50 minutes. I made it. Sorry I got off track there. That happens to me with pain. But the informal last few minutes here. Doctors and patients alike, do your pain agreements, okay? And live up to it. Which means doctors, don't just drop your person off their opiates. That's a very cruel thing to do. You want to get people off gently. You don't want to just say, okay, we're going to stop giving you morphine after 10 years. Okay? That would put me on the floor. I'd be dead. You'd have to carry me around. Literally. I'd have to go to the hospital and get a coma. It's feeling like that today too. Do some games. I might put this and all this uploads to YouTube. But clinical trials. I'm still doing them. I'll give you some more diseases next video. I don't know if I'll do one tomorrow for Friday. Maybe not. I might not see it till next Monday. But I'll try to be finding something over the weekend to give me more of a topic to where I can script it out. Because right now I can just going back through all my old stuff, and I'm just going from here to here to here to here to here. And I'm getting myself lost. Because I'm trying to do too many things at once. I've actually got a show I like on TV that I'm watching. So, anyway. We need to free marijuana from the prison of ignorance. And it is, because it is totally ignorant for people to say there's no medicinal value to cannabis, and then to give it to people as medicine. Okay? Big Pharma pushes drugs and kills. Marijuana cures you, heals you, makes you feel good, and it chills. What side would you rather be on? Okay? If you'd rather be over here with, oh, let's just pump people full of poison and kill them at 70% attrition rate, Mr. Cancer industry out there, 70% attrition rate. You've killed millions of people since 1975 by knowing that this cures cancer. This cures cancer. And to have prohibited it for this amount of time has gone beyond the ridiculous. And it just goes to show that there's greed and corruption that needs changing. We need change. Okay? So, let's get that change. Let's make that change happen. Share my videos around, even my hemming and hawing ones here. Because that's just me. It's my pain levels pop up on me with no warning. Right now, this muscle is actually starting to swell up. I can see it's even getting a bit bigger. This is sitting straight. Sitting straight. Okay. I'm gonna say goodbye. But marijuana prohibition is feeding the criminal empire. Legalize, legalize, legalize. And let people use it for medicine. And doctors, don't penalize your people for using hemp oil. Okay? Things with the chaga mushroom blend, yes, you do want to look for other drug interactions. But CBD will not interact with other drugs. It does its own thing. And what it does is the best and closest thing to a miracle cure that we'll ever have. And you can't deny that. Okay? That CBD is the saving of the human body and the planet. THC heals the soul, heals the mind, cleans off your brain's neurons. Painkiller. All being non-addictive and non-allergenic. You just can't beat that with a stick, folks. So peace out. Love, truth, and happiness. Free marijuana. Free hemp industry. Maybe I'll do a hemp industry video tomorrow, next week. We'll see ya. Take care. Have a great one. Be well. I say be well.